Okay, we're going to be going through a coherent neurological patient. So we're dispatched for a 70-year-old female patient who my partner and I, Ryan, are dispatched for a 70-year-old female patient who complained of a headache and maybe a syncopal episode. Her daughter is calling 911. We arrive on scene, come in nice home, meet daughter, walk in, and meet presumed mother. Introduce ourselves, hi, say hi, my name's Matthew, I'm a paramedic. What's your name?
Christina.
Christina. What's going on today?
Just not feeling well.
Just not feeling well?
No.
Do you have a bit of a headache?
Yeah.
Okay, I got a bit of a headache. I'm just going to feel your pulse here. Do you mind if my partner Ryan is going to, do you mind getting a set of vitals set up for me? And maybe getting things ready just to start an IV if you have time, okay? Just get things ready, I'll find out if we want to do that. So I feel an irregular pulse. It's a normal rate, normal rhythm, see normal level of consciousness, airway breathing. So she's coherent, so I'm going to ask her lots of questions. Alright, so when did this headache start? How long ago? About an hour ago?
Yeah.
Okay. I wouldn't normally. So, about an hour ago, your headache started. Were you doing anything at the time?
No.
No?
No.
Did it come on all of a sudden, or just kind of gradually over half an hour or so?
Gradually over half an hour.
Gradually over half an hour or so, okay. And never had anything like this before?
No.
Are you prone to headaches?
No.
So you, whatever you want.
Okay, no.
No, okay. And the headache, where, can you point to where it is in your head? Where that hurts?
Like right here.
Okay.
Yeah.
Does it feel sharp or dull, or how does it feel?
Kind of sharp.
Kind of sharp.
Mm.
Okay. If you were to give that headache a number, 10 being the worst headache you've ever had, and 0 being none, or no headache, what number would you give that? Could you give it a grade?
Probably like an 8.
An 8.
Mm-hmm.
Okay, so it's a fairly substantial headache. Are you feeling nauseated at all with that?
Yep.
Yeah, okay. Have you vomited at all?
No, not yet.
So if I'm understanding you correctly, you said this headache started about an hour ago, so let's say about 2:20.
Yep.
Does that sound about right?
Sure.
And it just started gradually, and it got gradually worse over 30 minutes.
Mm-hmm.
And it's in the back of your head, it's a little, you relate it as sharp,
Yep.
and 8 out of 10.
Mm-hmm.
Do you have any allergies to any medications, Christine?
Nope.
Okay. Sorry, I'm just writing down some things here. No allergies.
No.
And it's very kind. Your daughter has a list of medications. You're on. I see here you're on cardizem, warfarin. Do you have an irregular heartbeat? Has anybody ever told you have atrial fibrillation?
Yeah.
Okay. Synthroid. Metformin. You're a diabetic? Type 2 diabetic? You take that pill, the diabetes pill, the metformin?
Yep.
And we'll put you on ramipril. And you have a history of hypertension?
Yep.
Okay. Any other medications that you take?
Nope.
Have you taken any Tylenol or ibuprofen or anything for your headache today?
Maybe took a Tylenol.
Okay.
Yep.
A couple of Tylenol?
Yep.
1 or 2?
2.
2 extra strength?
Yep.
Okay. So past medical history, other than the atrial fibrillation, the hypothyroidism, the diabetes, and hypertension, anything else scream out that you have any other diagnosed conditions? No?
Nope.
Okay. Last time you were to your doctor?
About a month ago.
Yeah?
Yeah.
And what was that for?
Just check up.
Just a checkup?
Mm-hmm.
You take all your medications as you're instructed to do so?
Yep.
Okay. And how have you been feeling in the last month?
Fine.
Feeling fine in the last week?
Yeah.
Just today things went awry about an hour ago.
Yep.
It's a really bad headache. Okay, we're just going to do some quick physical assessment. My partner's going to start an IV there in your hand, if that's okay. We can give you some medication and you can drop some Gravol for me as well, if you don't mind. You can go ahead and I'm just going to start doing some quick physical assessment. Going to have you do a few things. Anytime people have a serious headache, we do some assessments to look to see if they might have some symptoms of a stroke. So can I get you just to repeat the phrase, "You can't teach an old dog new tricks"?
You can't teach an old dog new tricks.
Okay, can you give me a big smile? Show me your teeth. Okay, I noticed that you have a little bit of a facial droop there. Is that normal for you? Do you have a little bit of decreased movement on this side?
No.
You've never had any history of I skipped your history, that's really funny. Any history of any strokes or anything in the past?
No.
Okay. No history of any seizures? No? Migraines?
Just bad headaches. But
Bad headaches?
Yeah.
How often would you get a bad headache?
Maybe like a couple times a month.
Okay. I'll come back to your history in just a second. I'm just going to finish out that assessment. Can you just stick your hands out in the air and stick your hands out, palms up, and I'm going to get you to close your eyes. Yeah, close your eyes, and we'll just see if... Okay, there's 10 seconds. We'll get you to set your arm down. Okay, I'm just going to ask you a few more questions about your history. I asked you whether any family history of strokes?
Yeah, my dad had one.
How old was he?
45.
Okay. You have diabetes and you have hypertension.
Mm-hmm.
Are you very active? Do you walk much in the day?
No.
Have you ever been told you have high cholesterol?
Nope.
She's over the age, as far as 55. She's not male. Have you been any increased stress recently?
No, not really.
No, not really.
No.
Do you drink alcohol?
Special occasions.
Just special occasions?
Yeah.
Okay. But how many drinks would you drink in a week?
Maybe one or two.
Okay. Do you have any, and you have the history of atrial fibrillation?
Mm-hmm.
Okay. So you have quite a few risk factors for possibly a stroke, and you're having a few symptoms that could be a stroke. So we're just going to take you off to our stroke center, just to be extra careful, just in case that's happening. We want to get to that place with those physicians and equipment there. Ryan's got an IV in your hand.
Mm-hmm.
You're not feeling too nauseated right now? If we can get you over to the stretcher?
Yep.
How have you been up on your feet since this headache started? Do you feel unsteady at all?
Okay, I think.
Okay, we'll just see how you're up on your feet. We'll be careful. Ryan's going to come on one side. He's got that stretcher for us. And we're just going to, let's just pop that up just for a second, just while we're getting you moved over. Ryan, if you just want to come under, we're just going to come under your arm, and we're going to do a little do-si-do over, okay? You stand up on your feet.
Okay.
How do you feel on your feet there?
Alright.
Okay, if you close your eyes.
Kind of dizzy.
Kind of dizzy?
Yeah.
Okay. We're just going to walk over to the stretcher here.
Okay.
Ryan's just going to help you. You can turn around, Ryan, you'll just walk right around with her. Yep, and we'll just going to get you to sit your bum nice and high up here on the stretcher, okay? Okay, Ryan's going to, you can lean your head right back here, and Ryan's going to help your feet up, okay?
Oh, sorry.
No. Okay. Up we go. There you go, you're comfortable there? We're going to get you seatbelted in like a race car driver. We've got a lot of seatbelts, okay?
Okay.
And just have some shoulder straps. These are the race cars. These are the race car straps. Oh, you're getting ahead of me. We need the shoulder straps first, so you'll have to unbuckle.
Sorry, I'm a
Thank you so much.
lady.
Oh, you're very kind. How's that headache doing now? Is it changed at all, or is it just the same?
Kind of constant.
Kind of constant. No, that's fine. So I told you we were going to have all these straps for a race car driver. You're set to go. Are you feeling short of breath at all right now?
No.
Okay. I'll throw that cuff back on your arm here in a second, seeing as we're going to have to hang it here anyways. And, I'm just going to stick this over on this arm, over on that finger there, Ryan. I'll stick that on your finger, and I'll put this blood pressure cuff back on your arm. And while I think of it, I'll set the blood pressure to go off every 5 minutes. Okay, Ryan, you want to gather up our bags? We're going off to the truck. What was our blood glucose? 6.8, sound about right?
I'm like,
13, respiratory 36, 99% in room air, not having 6.8, and heart rate 78. Temp of 37.6, is that right, Ryan?
yeah.
Is it okay if I just set this on your leg, my clipboard?
Yeah, sure.
Okay. So we'll just lift her up in the air and we'll take her over to the truck if that's all right with you, sir. Okay. On 3. 1, 2, 3. Up in the air. Okay. We better take our bags too. I'll take one too. Just throw one right there. And then when we're done here, we go for a walk. And there's a lovely elevator that we take downstairs. This is a lovely building you have here. How long have you been in here?
5 years.
Oh, 5 years. It's really nice. I'm just going to set this up a little higher, Ryan. Okay, do you want to just lift those wheels up for me, sir? Few bumps. I should have warned you before. And if you want, I'll take that red bag here. If you want to throw the blue bag on, oh, it's up at the front already. We're going to go code 1 to the stroke center. You're all right with that, sir? Okay, how's that nausea doing right now?
Fine.
And your headache?
Same.
I'm just going to strap this monitor in so we can not get it. Ryan's a little bit of a crazy driver. Don't mind the bumps, okay? And I'll strap my other bags in. Okay, so headache still 8 out of 10 right now? How's your nausea doing? Are you feeling very nauseated right now? Not too bad, because I can. If you let me know if it gets worse, and I'll get you some Tylenol, okay, give you some medication through that IV. Ryan, how far out are we from the hospital? How long have we been recording?
Couple minutes?
How many minutes?
12 minutes?
12 minutes? Okay, we are 8 minutes away from hospital. That's very convenient. Do you want to just put me through to the hospital? I'm just going to give them a heads up that we're coming in, okay? I just have a few questions before I talk to the hospital. They just want to know so they can be all ready for you when we arrive. So I'm just hauling out my stroke prompt card from the protocols. So her ABCs are stable. She's currently, I wouldn't say all of these things out loud. She's got a facial droop and unilateral arm weakness, which is new today. Clearly defined symptoms, which started an hour ago. We're approaching an hour and a half. She's conscious. She's not hypoglycemic, and she's not bedridden, terminally ill, or palliative patient. Okay, you can put me through, Ryan. I'm ready to talk to them. Okay, QE. This is Charlottetown EMS, Unit 67. How do you copy? Copy okay?
Yeah.
Yeah, okay. We're currently transporting a 70-year-old female patient who has positive findings on her Cincinnati stroke scale with a facial droop and a left-sided arm weakness. She has developed this headache about an hour and a half ago, and it came on gradually and is now rating it an 8 out of 10. Her vital signs, her blood pressure is 217 on 104, respiratory rate of 36, satting 99% on room air. Blood glucose is 6.8. She's got a heart rate of 78, irregular. She has a history of atrial fibrillation, which she is in on the cardiac monitor, and her temp's 37.6. She meets criteria for stroke activation, and we're estimated going to be there in 8 minutes. Anything else you want? We'll see you in 8 minutes. Okay, I just talked to the hospital and let them know what's going on. I'm just going to go through some further assessment with you, if that's all right. I'm just going to... So, I'm just going to get you to do a few things for me. I'm just looking for an alcohol swab, so she can smell an alcohol swab. How's your sense of smell? Perfect, thank you so much. It was very convenient, Ryan. You were able to help in the front seat. Can you smell this and tell me what you smell?
Yep.
Okay. You can smell that all right? What do you smell?
Alcohol.
Okay. Can you read those words? Can you read any of those words on that piece of paper?
Mm-hmm.
What's it say?
For external use only.
Okay, that's perfect. Thank you so much. I'm just going to have you follow my pen, okay? So if you just follow the pen, I'm going to move it back and forth. Can I just move your glasses off? Is that okay just for a moment? So, okay, great. I'm just going to follow you in. I'm going to make you cross your eyes. Great. Thank you. And you're not finding you're having any blurred vision right now?
Without my glasses, yeah.
I'm sorry, with your glasses.
No.
Of course, with your glasses. Haven't noticed any changes in your vision at all?
Nope.
I'm just going to shine a light in your eyes, okay? You just look right at my nose. Of course, I put your glasses back on because I blurred your vision. Okay? Okay, pupils are equal, 4 millimeters reactive to light. She's got eye accommodation, and she's got no obvious nystagmus either. I'm just going to touch some things on your forehead. I'm going to get you to close your eyes, and you're going to let me know whether or not you can feel me as I'm touching you. I'm going to touch it with the end of the pen, and just something soft, okay? Okay, you just say, you let me know every time you can feel something, okay? So I'm going to observe that she blinks when I touch her forehead, okay, and you let me know when I touch you, okay?
Yep. 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 Yep.
Any differences on either side? Does it feel the same everywhere, from side to side?
It's different on my right side.
Oh, okay, so it
Yeah.
feels a little bit, in which way? How's it different?
Just not as prominent, I guess.
Okay,
Yeah.
you just close your eyes again.
Mm-hmm. Yep. 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 Yep.
Great. Okay, can you wrinkle up your forehead? Yep, it kind of wrinkled it up. It wasn't a real success, but it was okay. I don't know if you can actually. So we'll say you can wrinkle up your forehead fine. Upper eyelids is fine. I notice your eyes when you're looking at me. You don't have any droopy eyelids at all. Can I just get you to puff at your cheeks? Okay, just stop me from closing. Great. So you got good resistance. Stick out your tongue. Okay, great. So right in and go, ah. I'm going to look at the back of your throat for a second.
Ah.
Okay, nice symmetry of her uvular tongue's midline. Just going to get you bite your teeth together. So I notice here she's not clenching her master's muscles as well. Can you just let me know, I'm going to rub my fingers together. You let me know which ear I'm doing that in.
Left. Right. Right.
Okay, great. Any differences there between?
No.
No? I don't have any instrument. I'm not going to assess for a gag reflex at the time. We've already asked her, can you just repeat the phrase, you can't teach an old dog new tricks?
You can't teach an old dog new tricks.
Okay. And can you give me a nice big smile? I'm going to see if there's any difference from when we did it before. Okay, so she still has the same facial droop. Can I get you to just raise your shoulders? Okay? And just turn your head against my hand. Push my hand away. Push. Push my hand away. Okay, great. So we have a few abnormalities, but nothing. Just in regards to her face there and her muscle strength and the things that we found previously in her assessment. Just going to get you to squeeze my hands for me. Squeeze nice and tight. Okay. And I am noticing this hand's not. Oh, this one. There we go. Your right hand isn't gripping quite as well. Try to squeeze really hard. Okay, yeah, it's a little less. Can you lift my arms up? Lift my arms up. Lift up. Lift up. Lift up. Lift up. Okay, yeah. So a little bit different. What about over on this side when you with your feet? Can you push down? Okay, and pull up. Okay. So we notice a right-sided weakness there with her. We notice some unsteady gait as far as motor function. I'm just going to do quick sensory because we're almost at the hospital. How far away are we? Are we there now?
2 minutes.
What time is it on it?
19,
Okay.
20.
Okay, we're we're almost to the hospital there. Do you feel any, does this, I'm gonna touch it with your pen, like we did on your face, and you let me know if you feel any differences between the sides, okay? Feel any different?
Yeah.
Okay, how?
My right side was different.
Okay.
Yep.
Okay. What about?
Yep.
Okay. What about down here in your legs? Okay.
Yep.
Okay. Okay, just a few differences there. You're not feeling me really well on your right side, the same as you're moving. So it's good that we're moving off to the hospital. I'm just going to quickly do a little bit of a physical assessment. So notice, as far as, I haven't seen any scars, lashes, or scars, rashes, or lesions. I feel an irregular pulse. I'm just going to feel in your neck, okay? It's very convenient you had a stethoscope for me. I really appreciate that. I don't hear any bruit of any sort. Deep breath in through your mouth.